Hi there, this is Dr. Marcel, and this is going to be an exciting video to show you how to administer your own B12 shots. Now, a lot of you out there don't want to do this, and I understand that, but during a pandemic, this is an emergency situation. Number one, it would be best if you garnered all the individual skills that you can to maintain your optimal level of health. And right now, going to a doctor's office increases your risk of exposure in the environment. And, we're not sure what is going on with this pandemic. So let's try and get you as healthy as possible. So I'm going to show you how easy it is to administer a B12 shot. Now, first of all, why is it really that important? The favorite question I get every time I talk about B12 is, well, I'll take a B12 vitamin. That will work, won't it? Well, the answer is no. And why is the answer no? Because B12 is probably the toughest vitamin to absorb. It's in any animal product. So it's in beef, chicken, lamb, pork, turkey. It is in dairy products. If it comes from an animal, B12 is there. But it's very, very difficult to absorb. It requires a certain level of stomach acid, which a lot of us lose as we get older. And it requires hooking up with something in the stomach, but then it doesn't get absorbed to the very end of your intestines. If you've got an overgrowth of bacteria, they're going to eat that. They love it. So then they may eat it before it gets to the part where you can absorb it yourself. So no, if you are deficient in B12, it will probably not work to just take an oral vitamin. B12 is important for brain function, nerve health. It is therapeutic for bursitis, tendinitis, people with low energy. It can help with depression. People with allergies usually have a hard time absorbing this. So if you're one of those people with a lot of allergies, you may be deficient. And people, when they're 50 years old and up, only 50% of us have an adequate amount of stomach acid. So not only that, but if you have allergies, you probably had low stomach acid when you were a kid. So those people are really at risk. So let's give you a B12 shot. I'm going to try and make this as easy as I can and show you how to do it. Now, let's talk for 1 second about needles. I just saw a video where the woman said, oh, let's use an insulin syringe because why? The needle is tiny, tiny, tiny. And therefore, it probably won't hurt, right? It's so tiny. Where was this woman administering it? Into her abdomen. Ah, no, I'm not going to have you do that. Believe me. Let me say one quick thing about the needle length. For a B12, you want the solution to go into a muscle. Believe it or not, muscles don't have pain fibers. Do you believe that? It's correct. They have pressure fibers, so they can kind of feel pressure. But where are all the pain fibers? In your skin. So if you inject with a subcutaneous injection, which is what a tiny needle does, it just goes under the skin, that's going to hurt more. You're going to kind of push up a space between the skin and the muscles and the fascial layer, and that hurts. You want to go into the muscle, push a little solution, you'll feel a little bit of pressure, and then it will slowly go into your system in a nice, gentle fashion. You'll be fine. I lost you. All right, we are continuing on. Here's the vial of B12. I have it mixed up in a special way. This is methylcobalamin. It's what most research in B12 therapeutics has used. It is different than the prescription B12 available, which is a B12 molecule, still B12, but it's hooked onto a cyanide molecule. So it's cyanocobalamin. You know, this is a more natural form, and I have it mixed up specially so that people, and this is the one that works best in the brain. Why not use it? We have a brain, we want to take care of it. Okay, so you get your little alcohol, and you can get pads or you can just make your own pad. I'm going to try and adjust this so you can see. Here's my vial. So we're going to just clean that off a little bit, and you want to wait until it dries. La, la, la. You want to sing a few songs or count something up or do the dishes or whatever. But anyway, you want to wait till that kind of dries. It's 90 degrees today, so it should be drying pretty quickly. Okay, here's the syringe, the correct syringe. And you know, I don't like to hurt my patients. So yes, this is a long needle because it's going into a muscle, but what hurts is the tip. So if you use a tiny tip, it's not going to hurt. That's the important point. Fun. Okay, so you're going to twist this to make sure it's tight, pull it straight out, and then you're going to pull this down and get a little air in your syringe. You take the vial, hopefully you can see this okay, put it straight in, push the air in, and then pull it out. The way I mix this up, you will only need a half a cc. Pull it out, and then if, just in case there's some air, do this to drive the air to the top, and then you push it just a little bit. I don't know if you can see this, but anyways, it's fine and dandy now. I always tell people to carefully recap until you're ready to inject, because I can just see people answering the phone or dropping it somewhere or whatever. The cat comes over and coughs on the needle while it's sitting there. Anyway, now I'm going to show you on my leg. Now, in order to do this, I'm going to put my leg up here so you can see it, but you won't be able to see my face. There are no major arteries, veins, or nerves on the front part of your thigh. So this is a perfect place to give yourself a B12 shot. And here's another thing you can do to avoid pain. Wait until the alcohol dries. I usually check the periphery. If the periphery is dry, where you want to go is going to be dry. Okay, you twist it a little bit more to make sure it's nice and tight. And then you're going to inject bevel side down. And it's a little kind of torpedo kind of thing. You can practice this. But anyways, you just go boom, in like that. As you can see, I'm going to kind of make this so you can see it. My pinky kind of stabilizes this, and then you just carefully inject. If it hurts a little bit, you want to pull it out a little bit or push it in a little bit. That's it. I always take a little cloth and put it around the needle and pull it out. The reason I do that is because if you directly pull out a needle that's stuck in your skin, it's going to pull the tissue. So you don't want to do that. You have less trauma to the tissue if you just hold it with a little cloth and pull it out. That's the end. Wasn't that easy, and it didn't hurt a bit. You can do this. It's really important for your health. For instance, let me give you one for instance, and I'll close out. Let's say that you're trying to treat for tendinitis and you're having a lot of pain or bursitis. You might want to do one of these shots 3 times a week for a few weeks until you start feeling better. it would be pretty hard for you to come into the clinic 3 times a week. But if you know how to do these yourself, you can self-administer. You can always check with me if you have a question about dosage or procedure. But this is the basics, and you can do it. Take care.